Now, my name is Samuel Gaber. I'm an Evaluation and Research Manager with CADCA. I'm here to talk to you today about the God Outcomes application process for the God Outcomes Coalition of Excellence Awards. Now, each year CADCA holds this award, and we essentially give the coalitions a chance to be able to learn from everything that essentially, with the CADCA God Outcomes Coalition of Excellence Award, we want to give you a chance to be able to show us what you're doing in the communities to be able to achieve success, and more so, demonstrate to other coalitions what other strategies they can apply within the field. Now, each year, we essentially want to see that the goal of the award program is to help us understand and see where the change in your community is occurring. And we do this by helping you have a chance to be able to demonstrate to us where between the different years you're achieving success. And we do this by focusing on your data collection and more so what the data is telling us as you're moving forward within the coalition field. So with that in mind, you see here on this slide, we like to make sure that the focus of this program is through the strategic prevention framework. Now, in doing this, in understanding this, this is something that we're all familiar with as we go about and apply our various interventions throughout the communities. With that in mind, by taking measures such as the 30-day core measures that you may be using for youth alcohol use, as seen on the slide, we want to be able to see how you've been tracking it, similar to what you report in the DFC-ME system, and throughout this application and award program. So, looking forward into this, we see that there's many benefits for being a CADCA applicant within the Coalition of Excellence Webinar Awards. And that is free lodging and travel to the CADCA 2018 National Leadership Forum. Within this chance, you actually get a chance to be able to come and not only participate in the National Leadership Forum, but you get to be a presenter. Essentially, we want you to take what you've conveyed in telling your story in the application and then to be able to show it to other coalition members as a way of something they can learn to take back in their own communities. Now, with that in mind, we want to be able to also help give you a chance to be recognized in CADCA's printed and online communication materials. Now, our online communications gets disseminated to 20,000 people throughout the U.S. With that in mind, we are able to have many of the coalitions recognized, and I should say they essentially become celebrities in a sense that by being able to best way I could say this is that many people get to see your work on a much larger platform. And with that in mind, any winners also get the chance to be able to be considered as CADCA trainers and consultants. Now, this is a high honor for CADCA, and more so a high honor for any participant, because we're not only seeing how you can achieve success in your community, but we're allowing you to convey it on the National Coalition Academy platform and also on other platforms as well. So, now, looking at the application process timeline, we opened up the application process last week with posting coalitions online. And within this, you'll have a chance between now and August to be able to prepare your application and to be able to discuss your information and more so the logic model, and also various aspects of it in terms of how to best frame your data, how best to understand and see exactly where your story is moving, and more so how to frame it in a way that will be as well received among our CADCA our CADCA reviewers. So for the Phase 1 application, this will actually be due Friday, August 11th. After that, CADCA will select the semifinalists which move on to Phase 2. Now, this application process, just to clarify, is a Phase 1 and Phase 2 process. After you've made it to Phase 1, the Phase 2 applicants are then given a chance to be able to revise and refine their application so that it can be considered for then either the finalist category and hopefully to be able to present at the National Leadership Forum. Now, the week of August 29th will inform those that are moving forward to Phase 2. And feedback will be provided to the semi-finalists and the Phase 1 applicants that request it as well. We like to give this opportunity to be able to make sure that all the coalitions understand how you can best improve the way that you're telling the story, so that you're not only conveying it to us for the purpose of the application awards process. It could be something that you could take back and use in the community when talking to your board of directors, when presenting to community members, so that they can have on hand a reference towards the great work that you're doing back home. And then lastly, with the Phase 2 applications, those will be submitted Friday, September 29th. Essentially, we give them 1 month turnaround between submitting the Phase 1s to Phase 2s, and then our reviewers will be scoring that. After that, by early November, those that are moving on as finalists, being winners of the gut outcomes process, will be able to have a chance to then be notified and prepare for presentations at the National Leadership Forum. Now, with understanding that timeline, we give you enough time in the very beginning of it, being between now and August, to prepare your application, because we want you to be able to make sure that you have ample time and more so opportunity to be able to properly tell your story in the best context. Moreover, we do realize that the Mid-Year Training Institute takes place within this time frame, and we want to make sure that even as you're preparing for other grants that you're applying for and attending the mid-year, that you're not losing your opportunity to be able to share the great work that your coalition is doing. And moreover, if you do learn something new that can be applied in your application at the Mid-Year Training Institute, that's also an added benefit as well. So, that being said, we always like to say that people that are CADCA members, which are a many majority of the applicants for this awards program, are considered with great favor. With that, this is definitely also a good chance to see what kind of benefits you have as a member of CADCA, being able to access various resources that might help you in better telling you your story. Sorry, the slides keep jumping. With that in mind, we see that the emailed, you'll get emailed legislative alerts telling you of different public policy efforts that's going on within the field, and more so things that may be applying to your community directly. Other aspects of this, you'll see that you'll get discounted registrations at the National Leadership Forum and the Mid-Year Training Institute. And then you'll also get 2 electronic newsletters from Members Edge and Coalitions Online. Each of these are published weekly and monthly, being Members Edge every month and Coalitions Online published on a weekly basis. The information we provide there help guide you and kind of see what other examples are taking place in the field, being from other coalition members and also other stories in terms of what's new and relative in the substance abuse prevention field today. With that in mind, we also see that you'll get volunteer request referrals and also an eligibility to enter into CADCA-sponsored contests, scholarship opportunities, and various program discounts. And you also get the chance of being able to use CADCA's logo for branding purposes. You know, it definitely goes a long way in your community when you get the chance to say that I'm a member of CADCA, because it shows kind of that you're part of this broader movement that's being able to address the substance abuse prevention field today. So you can join at cadca.org/membership, and we'll be able to help connect you with our membership manager, Amy Pika, today even. So. Now, talking about the application process, we realize that we ask a lot in terms of being able to see you in terms of describing the community, the history of your coalition, the success, and more so how you've achieved that success within the time that your coalition has been functioning. So with that, we're going to talk about the application process, and we're going to walk through it together. So the award types for the application are split up into 4 types. The Coalition of Excellence Awards are split up into short-term outcomes, intermediate outcomes, long-term outcomes, and lastly there's a Coalition of the Year Award. Now for the short-term, intermediate, and long-term outcomes, we space this out between the number of years you were able to achieve a change within your community. Being for short-term outcomes a 1 to 2 year difference, intermediate outcomes a 3-year difference, and a long-term outcome which was a 4-year difference or greater. That being said, you see the perpetual change into standardization being that long-term effect that you're seeing in the community. And then lastly, with the Coalition of the Year Award, this is meant to award any coalition that successfully addresses 2 areas of substance abuse and demonstrates this success within the long-term outcome aspect. So, that being said, the applications, they focus mainly on letting you look at or conveying to us one area of substance abuse that you've achieved success. With that in mind, we'd like to say that you've had the opportunity to look and also demonstrate exactly how you've achieved success in one particular area. But it's not to say that you can only focus on that. If you have two areas that you have achieved success, we want to see it. We want to celebrate with you, and we want to see how others can implement that same aspect of success. So the application materials are broken down or what's posted on the link for the website, and I do hope that each of you have had a chance to go through the website and review some of the documentation. We have the Phase 1 application, we have the Phase 1 announcement, the definitions document, and the PowerPoint's requirement. Now, the application that we ask you to submit is in a PowerPoint format. Now, we ask you to do this because this allows you to be able to retain a copy of the presentation for yourself to use later in terms of another presentation that you can use when talking to, again, your board of directors, your community, or even potential funders. The definitions document will convey various important definitions that are relative towards this application process. With that in mind, it helps define kind of important terms that we like to see within your application. Now, this could be describing various aspects such as the 7 strategies of community change, and also other important terms that help us convey your message in a much easier manner. This being terms such as problem, root cause, local condition, short-term, intermediate, and long-term outcomes, and also the strategies, intervention, and the baseline assessment data. All these being relevant towards how you frame your story, and more so how you're framing it accurately and adequately for our reviewers and for consideration to be a finalist. In talking about this, actually, I want to make sure that you understand that within the application, we do ask that whatever interventions you've achieved it in reference to the 7 strategies of community change, and that's not in reference to essentially showing what aspects of the 7 strategies you've used when making that change in the community. So, look at the other materials. And then, yes, the 7 strategies document and the big picture overview data document and the Phase 1 scoring document. So we actually give you a chance to look at how the application is scored based on what's available towards our auditors, or I should say towards the reviewers. I want you to take a look at this when you get the chance in framing your application, because you'll see that you're meeting the mark in terms of what's required in the application, and more so what's required in terms of how you're describing the data, and that you've done it adequately and accurately. With that in mind, the big picture overview and data document is a document that we're going to be referencing in the next few slides, and I'll be able to explain that more once we see that. So again, the application is in PowerPoint format. We make sure that there's a 20-slide limit when you submit your application. We ask that you use 18-point font or larger, and that you have title background slides, and which help introduce your coalition and tell us the story, and also they bring the overview of the community in terms of the history that your coalition has been operating, the community you serve, and moreover, just kind of give us a sense of being able to paint the picture as if we're in the community with you. And then you have the big picture overview slides, the data intervention slides, and the outcome slides, being graphs, charts, and tables. Now the outcome slides, that's to say that with that in mind, that's to say that we want you to be able to make sure that's conveyed in a much more appealing and digestible manner for our reviewers. The best way that we always say to convey this is through using the data itself. And that's where kind of a picture is worth 1,000 words in this aspect. And I'm sure with many of you, you've worked with evaluators and also made presentations yourselves that have concluded where you're making the change in the community. So here's an example of what one of the title slides looks like. As you'll see, it has the logo. This is from one of our previous winners from last year, the Janesville Mobilizing for Change winner. It lists a person that was applying, their role, their contact information. Here it also shows the outcomes that they'd achieved, being short-term, intermediate, and long-term. The title being the prescription drug misuse, being the problem that they identified, and also the coalition name and address. So this is what we're looking for when you submit your application. This essentially will give us a reference to make sure that we have the right application from the right person, but more so is give us a breakdown of what the story is that you'll be telling us within the coming slides after that. This is another example slide from Janesville. This shows how they went through and described their community. They put a little bit of information in terms of the population size, the demographic breakdown, the number of students and youth they serve, and the median income. This is interesting. We always want to say that tell us the story about your community as it relates to how you're addressing the problem. Being that if you're addressing the problem in a rural area, if you're addressing it in a wealthy area, if you're addressing it in an area that's primarily full of a particular demographic, or there's a particular demographic that may be suffering from one particular substance abuse area that you've addressed, we'd like to see it. So this gives you kind of an example of what to look for. And then this is kind of looking towards the table of results that I was referring to. Now, as we talk about the God Outcomes application, we want to make sure that you're adequately showing the change in the results, being how you've affected that change among your community and among your target population. This being said, you see things that are represented here that are very important. Now, this is actually from these are from our Coalition of the Year winner from last year, the 100 Safe Communities Coalition. They were able to show us that they were able to achieve change in past 30-day alcohol usage among their 9th, 10th, 11th, and 12th graders as they went through within the period of years. And that's to say that this is how we like to see the data represented within the application, that you put it in this framework so that it's easy for us to understand and see the success that you're achieving. And using the past 30-day use in measuring the change, this is coming to an important point. We want you to make sure that the metric that you're using to convey your information is the same metric as you're representing it. Essentially, that if you were using a Pride survey, try to be consistent and show us that you use the Pride survey throughout those same years. In this case, it wasn't so much a Pride survey, but it was the 30-day high school usage. Since the question is the same throughout two different surveys, we're seeing that there's a consistency in how you're representing that data. So consistency becomes a very important part of this application process. It shows us that, one, you know how to adequately demonstrate the success in the community, but two, you're doing it in a relative manner with regards to the data that is represented. This is the big picture overview slide. Now, we provide a template online for how this looks like. In your application, as you're talking about how as you're mentioning, essentially, the problem, the root cause, the local condition that you're addressing, we want to make sure that you do it in this manner. Essentially, we teach this in the form of how you're taught in the National Coalition's Academy, being that the problem, and you insert the problem, being that it could be youth ages 12 to 15 are using alcohol, and then you want to know the why. Being they're using alcohol because it's easily accessible, and a local condition. They're using it because it's available at parties being hosted by parents. We want you to follow this framework because it's a stepwise process that helps us see that your understanding is exactly where and how the problem is occurring, and more so the reason for it, and how you've achieved success by targeting that specific problem. With that in mind, we do ask you to represent it in terms of two root causes, two local conditions per each root cause. This way that you're adequately showing the multiple factors that may be mitigating that problem. So here we have a comparison in terms of what's right and what's wrong. Not so much in terms of that idea, but how you're representing it. So we want to make sure that you've identified the problem is underage drinking, which could be in Evansville, Wisconsin. Then youth have easy access to alcohol in Evansville, Wisconsin. And then here, this is right, in terms of the local condition, number one being the retail establishments were not checking IDs, and youth were able to purchase alcohol. Now, I say there's a right and wrong to this because we want to make sure that as you're describing your root cause and local condition, that it's something that can be observed with or visualized, something that could be taken as a picture, because you're able to understand and show us exactly where and how the problem is occurring. Now, essentially, by that you've seen the how and the why, or essentially the why and the why here, as we like to say in the National Coalition Academy. So for this, we see the but why, they had easy access, and the but why here, it's because the retailers weren't checking. As you look in the bottom, we see that community norms supported underage drinking. This is a bit difficult to be able to convey via picture, so you'd need a little bit more of an explanation as to why community norms are supporting it. Is it because parents believe it's safe for youth to drink at home? Then the local condition could be that parents are supplying the alcohol at home. It could be something in that manner. So make sure that you stay consistent in terms of identifying the root cause and local condition, being as answering the questions but why and but why here. Then we look at the data intervention slides. This essentially looks at the problem again and how you're representing it in terms of the root cause that you've addressed, the local condition that the root cause that you've identified and local condition that you've also identified, and then the strategies. So you've gone through and you've told us that your problem is alcohol abuse among the youth, but also it could be understanding why it's occurring, being the easy accessibility and the fact that people were not carding them at the retailing establishments. And then we want you to put the strategies. Now this is where I come back to the 7 strategies of community change. CADCA is based in tying into the strategic prevention framework and identifying what strategies you use to identify and address the problem, and more so how it helps reduce and the incidence of the usage, and more so help make the change to make your community safer for that target population. Now, as you look at that, essentially we want you to be able to insert the intervention, name and description within this area bubble. And this template is actually provided online for you. That way that you can copy and paste it onto your application when you're formulating it. So we have here again the different interventions are providing information, enhancing skills, providing support, enhancing access, changing consequences, changing physical design, and modifying and changing policies. And we always like to say at CADCA, it's good to see that you've used a comprehensive set of strategies to be able to achieve success. This is very important because as much as you can, if you can show that you utilized a majority of the 7 strategies to be able to address your problem, that's definitely considered with high weight because it shows how much of attention, and I should say how much of an attack you've done to address the problem. And we know that not all the 7 strategies will probably use to address a particular intervention, but we want to make sure that that you've kind of used many of them, or at least as many as you can represent within this platform to show that how you achieve success within your community. And actually, there's a question here from Anna DiMercurio. She says, our coalition has only submitted logic models for 2 substances, but we also have strong initiatives to reduce other substances. Can we only submit a God outcomes application for substances for which DFC has received a logic model? Absolutely. I want to make this very clear that your DFC-Me reporting, it's meant to help complement it, that you used kind of whatever data you're representing there can definitely be used to help show and help strengthen your application when you're able to convey your story. That being said, I'd say that as long as the logic model follows this format, or if you can modify it to this format, you're definitely in good shape, Anna. So thank you for that question. I do appreciate it. Does anyone else have any questions before we move on? And please, if you have questions, please refer to the conversation text box. I'll be able to answer it there and address it for the whole group, because some people may be having the same questions, and I don't mind answering them. Okay. So again, I just want to make sure that everyone understands what the local conditions and the root cause. We talk about but why for the root cause and the but why here. Essentially, this is almost like understanding a cause and effect in terms of defining your problem. You want to make sure that how you're addressing it is identifying that, okay, alcohol use is occurring among youth. It's occurring among youth because it's easily accessible. It's easily accessible because parents, the parents are hosting parties and serving alcohol to minors. You want to make sure this is a stepwise fashion. It's very similar. And actually, I do have someone in the conversation box that's asked whoever's stapling papers to move that away from the mic. So thank you, Steve. We do appreciate that. And to give you again an example of how the data intervention slide should look, this is from one of our winners from last year again, the Hunterdon Safe Communities Coalition. They were able to represent data for the problem. Youth in Hunterdon were drinking alcohol. 83% of teens chose alcohol as their drug of choice. And they were also able to show that they used alcohol in the last 30 days, based on ADAS data. And then 45% had drunk alcohol. Then we come to the root cause. 12th graders stated alcohol is the most available drug. Teens listed alcohol as the most easily accessible. This both comes back to points of accessibility. Here we look at the local condition that friends over 21 were supplying alcohol to minors at the house parties on the weekends. That being said, this is very important. I want you all to take a look at this in terms of how Hunterdon represented their data. They went through and they used the data to support essentially the problem. This is how we want to see it in your application. Data is one of your most important friends. It's going to show you exactly what evidence you have that the problem is occurring, why it's occurring, and why there. Being as you saw here, it's that the teen friends were purchasing the alcohol for the minors, and then informant interviews showed that liquor stores indicating no violations for underage purchasing. This is very important. I want to convey this point that here, you see there's a good mix of quantitative data and qualitative, being survey data and interview responses. That's something very appealing to our reviewers because they show that you're not only using one source of data to corroborate the story, they're showing that it's all pointing towards how the problem was occurring, more so why it was occurring, and then how you were able to address it. And next we come to the strategy and intervention slide. As you look over here, we like to see with the strategy and interventions here that you list which intervention you applied as it relates to the 7 strategies of community change. Now, as you provide information, we see here that Hunterdon used the Know the Law campaign. This helps describe it in terms of what they did to provide the information to the community. They enhanced skills by teaching teams by teaching refusal skills to youth. And then they provided support to Youth Coalition alternative activities. I want to specify here, providing support could also be volunteering at various events that support law enforcement that have helped address and reduce the problem. It could be volunteering at sobriety checkpoints or spreading the awareness in terms of the risk towards that harm. And then enhancing access to reduce barriers. Here they had what was known as a diversion program. This helped kind of inquire about the access and follow-up with suppliers towards a specific issue. And then they also changed consequences. They helped the high school have a code of conduct which changed to lose privileges for students testing positive for alcohol. This is important because the consequences themselves are important in how you convey the change in behavior. That being said, this can also be seen in how you modify or change a policy, whether that's enacting an ordinance that helps people responsive. And lastly, changing physical design. Changes were made to ban the area under the bleachers at the high school where kids brought alcohol, and also lastly, modifying the policy, enacting an ordinance. Again, we see that a comprehensive set of strategies were used to address this particular problem, and more so how it was used on a wider front to be able to address it as a whole within the community. Again, if you have all 7, that's great. We want to see how you represented it within all 7. If you don't, that's fine too. We just want to see how you're able to address the problem with a variation of these strategies. Now, tips for applicants. We want you to review all application materials. We want you to connect with your evaluator and your data committee members about your outcomes in supporting your data. This being said, I know majority of you have hired an evaluator to help with the process. This is important because the evaluator that you've been using to help collect your data, analyze it, and report it out, sorry, that just jumped again. The data that you've helped report it out, it will help understand exactly where and how, understand exactly what data you can use to convey your story, and more so, it's already been used within maybe your DFC and your reporting measures. I'd also say, please feel free to call me or a technical assistant to be able to discuss your plans or questions. I'm very happy to answer your questions. I'm here to support you in any way possible to help make sure that you send us your application, and more so to help tell your story as best as possible within the application. I'm happy to always help. I'm going to be one of your best friends within this whole process. And also work as a team on the application. It's very easy for people to be able to kind of leave this to one person. It could be a volunteer. But I definitely want to say this is a great chance for you as a coalition to work together in telling your story. Because there's so many of you doing great work out there that it's great to see kind of how you're even cooperating together to be able to tell the story as one. And then contact CADCA's Training and TA, Manager for General Support and Logic Models, or you could contact me as well. Jennifer Braun actually writes a question. She said if you're interested in applying for Coalition of the Year, is there something that is done differently during Phase 1 process? Actually, that's a great question. For Phase 1, all we want to see is represented one specific drug problem. If you have two that you want to highlight, that's more than fine. But we don't, I'd say for Phase 2 is when we like to see that between Phase 1 and 2. If you can represent in Phase 1, you already have the battle there. You can kind of demonstrate to us early on how you've achieved it. But within Phase 1, if you only have one that you want to show at the moment, that's fine. It just so happens that within Phase 2, if you had a second one that you've seen progress in, because I say this all the time, since this is working within real time as well, if you have data to show that you're just now making change within a second area, whether it's prescription drug abuse, but your Phase 1 application during the time of applying was only for alcohol, you can then cater it towards applying that. But I would like to say, as early as possible, if you can show it within Phase 1, that would help. This is kind of why we do give a lot of time as well, being between now and August to submit your application. So Jennifer, thank you for bringing that up. I do appreciate it. And now we come to the last slide, being my personal thank you for all of you joining this webinar. I see just by everyone here that there's a great interest in people wanting to apply, and more so being able to celebrate in the achievements that you're doing. I'm looking forward to seeing all of your applications. With that, I do want to open up the floor in the conversation text box to any questions that you might have so that we can answer them together and see if it's something that many of you are thinking about. So please feel free to write in the conversation text box. Can you print the presentation slides? You can. What I'm going to actually do is I'm going to make these presentation slides available to all of you after the webinar. And so with that in mind, I'd like to make sure that as I send it out, you'll get a link towards where you can download the application materials as well, and make sure that you're well connected. So, is there any other questions? Thank you for bringing that up, Lucy. I do appreciate that. Can I ask, just out of curiosity, you can type this in the chat box. Have many of you applied before? No? Okay. Yes, we did. Perfect. Yes, Jennifer, I do remember your application from last year. Ah, okay. All right, this is actually very good. I'm glad to see this. So many of you are very new to this process. And that being said, I am very interested to see what achievements you all have accomplished within your communities. Now, I do want to go back to Amy Sklanik's question. Do you need to show all three outcomes, or do you choose one outcome? So that's a good question. You get to choose, okay? So if you have outcomes, or if you have success that you've achieved in short-term outcomes, you can feel free to show that. If you've achieved it in intermediate, then we'd ask that you show it and for intermediate and short-term as the comparison, being the span of years, and then with long-term that you show all three. So this is where the difference becomes in how you represent your data. This is a very important question. I'm glad you did bring it up. So. Okay. So can I ask, are there any other questions out of the group? Well, I do hope that this webinar has been very helpful for you. Actually, sorry, we do have more questions. Yes. So Erica, thank you for bringing that up. When are applications due again? Phase 1 applications are due on August 11th, all right? Then the Phase 2 applications will be due September 29th. And I'll come back to that slide real quick so everyone can see it. The format for the slides. Sabrina Harmon, thank you for bringing that up. The formatting that we have is rigid just in terms of the information you put on there. But if you want add a little flavor, like essentially I want to make sure that you're using 18-point font so that it's large enough that our reviewers can see it. But also, but you can add your own texture to it. So, okay. Are there any more questions? And actually, let me ask a question to the audience again. Have any of you reviewed any of the application materials yet? Perfect. Good. I'm glad to hear it. I always like to see that in the beginning because it kind of gets everyone familiar with kind of what we're talking about and more so what will be expected of them as we move forward within this process. So, great. This is a good question too. So, Sabrina, I'm glad you brought that up. So, as we look here, in terms of the award types, so one coalition is selected for each award type as a winner. So there will be a Coalition of Excellence Award winner for short-term outcomes, a Coalition of Excellence Award winner for intermediate outcomes, a Coalition of Excellence Award winner for long-term outcomes, and then a Coalition of the Year Award winner for those that have successfully addressed the two areas. So essentially, we give out 4 awards for one coalition. Not for one, for one coalition for each of the 4 awards. Okay. Does that clarify your question? Perfect. Okay. Does anyone else have any more questions? Very good. Okay, so I do hope that this has been helpful for everyone and that it has encouraged you all to apply because I definitely want to see how you all are achieving success in the communities. You see, as CADCA, we are here to support you in every way possible, but being able to see it in terms of how we've been able to help guide you and then you've been able to achieve that success in the field, that gives us great joy to be able to see that because that means that as that collective, we're all working together towards the same goal, and it's happening. So with that, I want to thank all of you for joining us this afternoon. And again, please feel free to email me or call me with questions or answers. Or questions, and I'll be happy to answer as many as I can to be able to help make sure that your application is submitted and that we can go forward. So thank you all. And this will conclude our webinar.